We're going to welcome you back to Tri-County Animal Clinic, and from this point forward and a number of the shows, we're going to talk about parasites. Our two primary areas of interest are going to be GI or intestinal stomach parasites, and also we're going to talk about heartworm disease. Laboratory testing is a big part of veterinary medicine. It doesn't have to be overly complex. We routinely check for intestinal parasites. It's a standardized test and most clinics do use. We collect a stool sample and we ask owners many times to bring in a collection of feces. That particular material is then deposited in a salt solution. And I have a salt solution right here. How this works is the salt solution helps, because of its concentration, helps to float the eggs of the parasites up to the top surface of this particular container. We have this container now set up with a slide. Those eggs float up to the bottom surface of the slide or the cover slip after a timed period of about 12 minutes. From there we take the slide and then we go to the microscope and we'll actually look for parasite eggs. Common parasite eggs that we find are going to be roundworms, hookworms, and whipworms. Tapeworm eggs are real common, or tapeworms are a real common parasite, but the eggs themselves are difficult to find under the scope. Tapeworms are seen by owners most likely and most often in their stool. The parasite program is a big part of what we do in veterinary medicine because we have a lot of problems with young puppies and kittens. It also can be a problem of adults when they have a poor start to life and they have poor nutrition and their immune system is not able to help fight off the parasites. Testing again is very simple. It's recommended in all puppies and kittens and once a year for adult dogs and cats. Here we have a good presentation of a few of the eggs that we see in our stool samples, our fecal floats. We have right here, this is a whipworm, and a lot of people have heard of whipworms. This is what their egg looks like. It's kind of football shaped and it's got two little operculum on each end. It's very distinct. And then we have a hookworm. Hookworms are very oval. If you can see this closely, that some of these they actually have circles in there, and these are the premature or the developing worms that are in the eggs themselves. The one other common one that we see, so many people are familiar with, are roundworms. Roundworms are not seen here, but they're more of the egg itself is literally round, just like the worm is itself, and it's got a very thick shell and a dark center. But these are the things that we're looking at to give us indication of what we might find on a dog stool or a cat stool. We have another primary parasite that we're concerned about in dogs and in cats. Is heartworms. Heartworms are transmitted by mosquitoes, and we find heartworms in every state in the union. The primary areas that we see obviously are going to be our area here. The southeast region is a very large region for heartworm disease. Any areas where you have a lot of rain and a lot of water, rivers and lakes and ponds, this helps with the mosquito population and helps to spread this disease. Testing is a simple little blood test. Initially, all we do is we draw a little bit of blood. We use a testing system manufactured by IDEX. The blood is then placed into a small test tube and mixed with a diluent, or actually a reagent. And that particular material is then passed on and placed into a snap test. The blood goes in this well right here. As you see, this is a test that we just ran, and the results take about 8 to 10 minutes. The results actually show up on this window screen here on the test. The one blue spot, though, is a negative, or excuse me, a positive control, and does not indicate that this individual has heartworm disease. This test is very simple, very accurate. It is specific for dogs. For felines, there is a specific test for them. Heartworm disease in cats is whole nother discussion, but it's primarily seen in as many as 20% of the cat population. It's not diagnosed as often because we don't have the coughing and the obvious heart disease that we normally see with dogs. Cats that exhibit signs of heartworm disease, you will see many of those to have vomiting. They will have asthmatic-like attacks. They can have difficulty in breathing, and under those circumstances, it's definitely on the list to test for feline heartworm disease.